Hello, everyone. Welcome to today's Continual Improvement webinar on Laboratory Nonconformance Event Management. This is Sierra Tollefson, an Education Specialist for Mayo Clinic Laboratories. Our presenter today is Jason Morovich, an Event Management Coordinator in the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. Just a couple of things to remind everyone of before we begin today. There will be a question and answer session at the end of the program. You can submit questions online via the Q&A icon in Zoom. Please only use the chat function for any technical issues. Today's program is being recorded and will be posted to our website in a few weeks. And now I'll turn things over to our presenter.
Thank you, Sierra. Good afternoon or good morning, depending on where you are, everybody. My name is Jason Morovich. I am the Event Management Coordinator for the Department of Lab Medicine and Pathology. Event management is what we internally refer to as nonconformance management. Other people might refer to me as the adverse management coordinator or adverse event management coordinator. Lots of different titles, one person. So just a quick disclosure slide today. I have no relevant financial relationships as it pertains to this discussion. And we're not really going to be talking about any off-label usage today. Learning objectives for today's discussion. Today we're going to kind of have a non-traditional event management discussion. We're going to be talking about the influence your work unit culture has on non-conformance reporting. We're going to talk about event escalation pathways with lab operations and other individuals in your organization. Then we're going to describe the key elements of an effective non-conformance management system. And in a nod to all of this, we're going to do it all in reverse order. So let's talk about non-conforming event management, or I'll just probably refer to it as event management going forward. First, a bit of housekeeping. Mayo Clinic's Department of Lab Medicine and Pathology, Mayo Clinic Laboratories, has adopted the CLSI model of quality management system. Non-conforming event management or event management is just one piece of an overall quality system that includes structural elements such as the customer focus, QSE, facilities and safety, organizational and leadership quality system essentials, personnel. You have your process grouping of quality system essentials, such as equipment, documents and records, information management, purchasing and inventory, process management. And then you have the outcome elements of your quality management system, of which non-conforming event management is one of those, along with continual improvement and assessments. So it's a little bit of housekeeping, but I want to go beyond that. I am the adverse event management coordinator for the department, but I am not alone in my efforts. Everything that we do at Mayo Clinic is a team effort. There are over 150 individuals in our Department of Lab Med and Pathology that have the word quality in their title. And they are supported by a slew of technical positions, supervisors, and other individuals that really help to work through all of the quality management systems, but especially event management. As a department, we are organized at the department level with 7 testing divisions, being from anatomic pathology to lab genetics and genomics to your hospital clinical laboratories and your central clinical laboratories. We have, in that 7 division structure, we have over 70 performing laboratories that are unique. Our current head count is somewhere around 5,000 FTE. We're a big operation. We have a lot of moving parts, a lot of very unique parts, but a lot of parts that you would find in any hospital system or laboratory system that you would walk into anywhere in the country. So let's talk more about event management. Event management on its own doesn't function without the larger elements of the quality system and these other elements represented here on this slide as gears, have inputs and outputs into our event management system. So for example, you can have a facilities and safety item, right? And say you have your humidity dropping below manufacturer specified ranges during the winter, or perhaps during the summer, depending on your geography and where you are in the country. And that facilities and safety issue can be an input into your event management system. Likewise, purchasing an inventory. You may have a reagent or a consumable recalled, and that impacts current or previous tested results. And now you are facing amending or revising a slew of lab reports. That is an input from another quality system into event management. Likewise, with equipment, you can have failures and unexpected malfunctions and outcomes, and that is all part of things that feed into your event management system. A high-functioning event management system does not exist without a high-functioning quality management system. Additionally, we have the inputs into event management, but event management actually can serve as a jumping off point for multiple items. You can have your event management system providing outputs to QSEs, such as your internal audit program operating under your assessment QSE. Your events can clue you into operational areas for potential targeting of internal audits in areas that need some further scrutiny. If you have continual issues with pieces of equipment or a supply, your events can point the way to a vendor qualification issue. And that would be under your purchasing and inventory QSE. Additionally, you could have customer concerns, around turnaround time, something near and dear to every laboratorian's heart. And those concerns about turnaround time can clue you into the need to potentially modify testing delivery for specific patient groups, or a need to organize your workflows differently. So when you look at this, understand that the inputs and the outputs of an event management system touch all the other elements of the quality management system. They don't rest alone. So a point of starting from a common ground, every organization needs to develop what they consider a non-conforming event. Today, for purposes of this discussion, I'm really not going to go into what different regulatory agencies or state reporting requirements are, what different definitions are as far as different accreditation organizations and such. We're going to talk in high-level discussions about the topic of event management. So non-conforming events, very briefly, this is our definition at Mayo Clinic: something that deviates from our established lab policies or procedures or workflows, does not comply with applicable regulatory and accreditation requirements, or it has the potential to affect or has affected patients, donors, the general public, or personnel safety. That's our definition. It's pretty simple and yet incredibly complex when you sit back and look at the depth and breadth that it entails. If your organization is accredited by CAP or another organization, you've probably seen the checklists, and you know that those checklists are filled with accreditation requirements. So again, a simple definition for a point of level setting today, so we can jump off onto our next discussion. So I want to start by going through some of the elements and underpinnings of the event reporting system. And this slide purposely has your organizational culture at the center of every element on the slide. Culture is really, when it comes to so many things in our lab systems, but it's especially important in non-conforming events. You can have the best electronic reporting system available, And if your employees don't believe that they're going to be safe in reporting events and they fear blame and retribution, they're not going to partake of that tool and report the events. So let's take a minute and stop back and look at detection. Detection in an event management system is, how do you find nonconformances? I want you to stop and think. How do you, at your organization, find events? Or do those events find you? Do people seek you or others on your leadership team out and tell you or show you what is wrong, or better yet, what almost happened, and they caught it, as in a near miss? Do you have work group huddles and handoffs where people tell you about events? Do they tell you what went well on the shift, but also what didn't go so well and where some events may have occurred? When people are in a safe space, they will offer you information. As a leader, as I suspect most people on this call are today, as a leader, you need to protect the voices of those individuals who speak up. You have one chance, if not limited chances, to really listen to those voices and protect them. If the messengers are disregarded, if you don't listen to the canaries in the coal mine, you're going to extinguish that behavior, and people will no longer raise up the issues, and you will be deprived of that information flow into your operation. Let's talk a bit about huddles, because this is a great opportunity. We have operational huddles at the beginning of shifts, at the closing of shifts, at handoffs of shifts. We have what we call MDI boards here in our organization, managing for daily improvement. They have multiple swim lanes on them. Each swim lane is tasked to a different subject, be it safety of the laboratory personnel and the testing, the delivery. Are we meeting our delivery quotas or our turnaround time? Are things going as planned? What's going on with our people? How are we staffed? What's the quality of our overall operation today? And then what is the productivity and how are we doing? A lot of events come out of these discussions. A lot of these events are just do it projects. They're small things that we can take care of. They're potentially PDSA problems, plan, do, study, act, opportunities to improve our situation. But we also have Kaizen events and larger events that come out of this where we really have to take a step back and go through our full event management process. Additionally, in your detection of events, do you have set thresholds for reporting events to certain groups? Internally in our organization, we have an expectation that if a laboratory revises more than 10 previously reported results, they have a set escalation pathway for reporting and making a certain group aware so the group can help facilitate the lab in the event results and reporting and the revision process. Also there to address the immediate actions of the laboratory and also coordinate any additional things that come out of that larger revision. For every event like that, it's always a learning experience. So up to this point, we've been talking essentially about push notifications, people telling you there's an issue. There are also many, many pull or passive notifications as well. Our labs have reports and metrics that inform us about the performance of systems and processes. I imagine at your organization, you have metrics set up and metric reports are given to you daily, monthly, quarterly. My question is, do you have thresholds? And when those thresholds on those metrics are exceeded, and there's excursions, in quotes, we'll call them excursions today, are those treated as nonconformances? And now, I'm not suggesting that every time a threshold is exceeded, you need to perform a root cause analysis, but data should not be discounted And we should scrutinize the data as it's telling us a story. If it's a single issue, you might have a single special cause. There's a specific reason why that data is out of specification. If you have a trend, you would probably need to investigate much further. And we all know that some metrics demand more action than others. Analytics and quality control demands attention before the results are reported. Unsuccessful proficiency testing requires attention and investigation and documentation, I might add. And these are some of the many pathways we have for detection. So we've talked about a lot of push and a lot of pull, and then there are the actual inputs. So we have an electronic reporting system at Mayo Clinic, and on any daily basis, we have a group of quality individuals throughout our organizations that are in our event management database, and they are looking at the actual inputs and the reports that employees and our customers are submitting, and they're looking at those in our defined system. So we have multiple ways of detecting events through the push, the pull, and our reporting systems that we have established. After we detect these events, between detection and reporting, there's always going to be the need for that immediate action. Immediate action is required to address the event once you learn about it. This can be as simple or as complicated as canceling a test and recollecting the samples. The simplicity or the complexity often belies what type of sample you're acting on. And then also calling out results if the results have been impacted. So there's that immediate stimulus and the response. And then sometimes we also get into the actual reporting. So you have your detection, your immediate reaction to ameliorate and respond to the immediate need. And then we need to report that into our defined system. When we're looking at our reporting, again, we need to have organizational culture at the center of that, right? We talked about protecting our employees and protecting their voices when they raise issues up. When we're reporting, we often need to know the who, the what, the when, the where, and the how. Now, the who is found in the event, but it's not who you think caused the event. I want to know who is reporting the event. And the only time I really, as an event management coordinator, want specific names in there is when they're patient names. We have the ability in our system to scan in patient names through our system is interfaced into our lab information system, so we can scan patient labels and import impacted patients directly into our system. And that's the who. The who of our event reporting system is the patients that are being impacted or the people that are reporting it, so we can know who to go and follow up with. The how in the reporting section is not so much, and I laugh because it's not how the reporter thinks it happened. We'll get to that down in the investigation, the remediation section. The how is how you found it. I want to know what mechanism alerted you to this issue. I want to know the processes associated with how you found it, what process broke, how did you find it, what were the things that alerted you to that presence. We also need the what, the when, and the where. When staff are entering events, I ask them to tell me a story. Keep in mind the story has to be easily understandable by someone who doesn't have a complex understanding of the situation as the person submitting the event. We have a very, very large department. If we have events that are being rolled up and categorized at later data analysis steps, we need to be able to look at those events and understand essentially what occurred. When staff are reporting events, keep it simple, keep the understanding basic, and also remember that events are records. These are one of the outputs of our documents and records quality management system, and they need to stand the test of time. We need to be organizationally sensitive and cognizant, and we need to keep our event submissions clean, respectful. This isn't a place to be bombastic, sarcastic, or lay out your grievances. That's not what we need in our events that are being reported. They should include the facts impartially, and they should include the facts that the reporter knows at the time of reporting, and avoid speculation on causes. Again, we talked about not commenting on specific regulations today, and don't take this as legal advice, but please note, events can be considered discoverable in legal proceedings depending on the state your laboratory resides in. And it's very important that we impart on our staff when they're entering events, we need them to be factual, relevant, avoid blame, avoid speculation. When we look at our reporting required elements for our system, the barrier to reporting and entry is really low. The date the event reported is auto-generated. I want individuals to tell me when they discovered it. I want them to tell me where they work, what work unit, what department, what division, what laboratory. I want to know where it was found. If they can tell me, I'd like to take them a first cut at where the event occurred. But other than that, I need them to tell me a complete story of what the event was to the best of their ability. So if we have additional questions, we can go back and get those questions answered. So on this slide, you see reporting times 2. There's two really mechanisms of reporting. There's 2 levels of reporting. There's the report that we put into our event management system, and then there's a larger report where we need to tell potentially other individuals about our event. So this is a list. It's not all inclusive, but in addition to the event going into our reporting system, we need to be actionable on those reports. Not in all cases, but in some cases, we need to report those to expanded groups. This list is not a complete in any way, shape, or form. I'm hoping that you have a list of this nature at your organization or in the back of your head, or at the very least on a sticky note on the side of your computer. We have our CLIA lab director or a technical supervisor and section directors. Those individuals need to be made aware of events at certain times. There should at least be reporting mechanisms up to those individuals or delegated individuals on a monthly basis. But think about expanded reporting. What are the laboratory's customers? Are they internal? Are they external? Is your organization part of a group practice? Is your organization a referral laboratory for other laboratories? When you have events, are there potential physicians and care teams that you need to reach out to and talk to about some revised reports or some questions that we have from product corrections received from manufacturers? Also keep in mind that those areas can impact surgical collection areas as well. If you have a pathology practice at your organization, pathology and surgical collection areas go hand in hand. We need to have an easy mechanism to communicate concerns and ideas back and forth. You may have test results that, upon being revised, impact transplant and transplant coordination groups. So you need to know who those individuals are. Reporting disease, public health. It could be a blood lead, it could be HIV. If you're revising those results, there's the revision that goes back to the clinician, to the patient, and then we also need to follow up with our public health partners and letting them know that those results have changed. Occupational health, internal reporting for our organizations. And I have the patient safety and risk reporting as two separate line items. They may be different at your organization. Patient safety reporting is working with our institutional teams and partners and to do the mandated reporting to any organization at our state or local level that we need to concerning sentinel events. We talk to patient safety from a lab medicine perspective, not infrequently, but we're a large organization. And then also risk reporting. There's a lot of PHI that is on every single tube that is moved throughout our laboratories. If you have couriers, internal or external, how are we handling that PHI? Have these phone numbers handy. Other groups that we talk to and potentially need to make aware of revisions or cancellations are billing teams for the various systems that our lab information system feeds into and our billing systems feed into. You may have a separate group that does revenue accounting. So you have one group that does the billing, and you might have another group that is responsible for revenue accounting. And if you have a larger event where you're looking back over the scope of months and potentially canceling or revising tests, you may need to talk with them. Lastly, organizational legal counsel and public affairs and patient affairs. Public affairs from a media perspective, patient affairs, when you have an event that impacts the life of a patient and causes any type of concern there. Sometimes our patients are contacting us. Sometimes we're contacting our patients. Some events, some examples of things where we've communicated to this expanded team. Sometimes we'll have a product correction notification come from a manufacturer and a vendor partner, and we'll have a consumable change that now we have to look through our testing. And upon looking at that testing, we see that we need to go back and change some test results, and we need to engage with those broader teams. Every time I talk to people that are on this list, I learn something about their work and they learn something about laboratory work. And I always learn more than I give away, or I always learn more, I should say, than I contribute to the conversation. At least that's how I feel. You may not know that these resources are at your physician or at your facility until you go out and find them. And I would encourage you to do that. The time to find these resources is not when you need them. It's when you have the luxury of time to make those connections, know those people, and develop those relationships. So if you looked back at our reporting, you'll notice that we didn't have the why in there. And we talk about the why in the investigation and the remediation. If in our reporting, we're already jumping to why something happened, we're probably engaging in some type of speculation, and we haven't really stepped back from the event. Again, with your investigation and any remediation that you're going to do for an event, just the facts. Emotion, opinion should be left out of the event write-up. You need to look at what the data tells you conclusively and not speculate. If the data can't tell you how an event is occurring, how can you get more data and validate that the event is or isn't happening via a certain pathway? An example that I've been part of was a computer-related issue where we had intermittent software problems causing a small report element not to be included on the final report. It was not critical to the interpretation of the results or the communication of the results, but yet it was intermittently not there. And when I say intermittent, less than 1/10%. We were able to isolate and correct the reports that had this issue. And we were able to put a monitoring mechanisms in place to correct issues in real time going forward. But in working with our software vendor to correct this issue, they could not tell us why it was occurring. They needed more data. So what we worked with them and did was they installed a data tracking system in the software so that they could, at a later date, consume that information and come up with their remediation. Sometimes we have to expand our investigation to include other partners that we normally wouldn't talk to or consider in the solutions. In this case, we worked part and parcel with a vendor to trace the situation back to the origin. You have to expand your investigation. So one of the things that we have started doing, and I encourage you to do as well, is when you have events, take a minute and pause as you're doing your investigation. Ask yourself, is this a single issue or is this a system issue? And does it have the potential to impact other areas in our laboratory? Or if you're a multi-site laboratory, does it have the potential to impact other sites? We have been, and we have started to be conscious about how we communicate. And we communicate investigations and issues with our other sites and locations and laboratories, even if it doesn't potentially impact them. And by picking up the phone or sending an email and having those larger conversations, we have started to seed the idea of cross communication. And this is organizational and culture related. This is picking up the phone, calling another lab at another location and saying, we've found this. You may or may not be seeing this, but we thought you should be aware of it. And what we found is it was contagious. That open communication between our sites has, over time, spawned more feedback to us. In Rochester, we have seen that communication model take hold. And now when something is occurring at one of the other laboratories, it's quite often that we hear about it and we have the ability to assess that and see if maybe this is something that we didn't see or we weren't aware to. How you communicate and how you create safe spaces to do it across your organization will make your non-conforming event management system much, much better. When you're doing your investigation and your remediation, one of the things that we at our organization always keep at the forefront is we have 5 safe behaviors. These behaviors are not unique. You can find them if you do a Google search on the internet. But really, what are those safe behaviors in our organization? They're pay attention to detail, communicate clearly. Again, that relates to event reporting. Speak up and respond respectively. Whenever we are doing anything in the scope of event management, we are, if anything else, straightforward but respectful. We are handing off effectively communication from one group to the other, clearly articulating what needs to be done. And at the end of the day, we support each other. At the end of the day, we are all here for that patient and to make sure that they have the best outcomes they possibly can. So what are some key considerations? These are my opinions, but nobody comes to work to do a bad job. You can see this borne out by the human factors in the just culture. You can Google just culture and find a slew of articles on it. At the end of the day, it is basically stating people don't come to work to do a bad job. Everybody comes to work to do the best job they can on any given day. Secondly, people are involved in events, but usually the system is at the root of the issue. And this middle point here about systems and human causes, I want you to be very, very attuned to and aware. If you, as a leader, are looking at a report, an event report, and you get to the end of that event report, and the cause for that event was human error, I want you to take a moment and pause and reflect. And is it really human error, or was there a larger system at place? Was there a training issue? Was there a competency issue that was systemic that we were unaware of? Is there other items and other systems that you may not yet be aware of that could have potentially impacted this? As laboratorians, we work in incredibly complex spaces. The results of our work have life-changing ramifications for some of our patients. And we do a really good job of building systems to make sure that they function optimally. But when you are, at the end of the day, looking at a report and it says there was a human caused event, question that. It might be true, or there might be a system that's at the root. I bet if you look, you'll find an additional system. I think the data indicates 93% plus of all events are related to system issues, and the other 7% are related to personnel issues of various kinds. And then they break that down when you look at the just culture matrix. If you're looking at your events and half are related to human errors, you probably have an opportunity to look a little harder and find some systems. And this last one is a pet peeve of mine. I don't want to give away my pet peeves, but I'm happy to share this one to anybody who will pick up this mantle. And it's computers don't program themselves yet. This one, along with the human errors, is something that I see as a weak point. Oftentimes, when pressed, because we are so busy and we don't understand the computer systems that we work within, we use on a daily basis, we can explain away things as a computer glitch. Computers do not program themselves. People program computers. There is a reason that that computer system is operated that way. And while it might be hard and it might take a while, you can track that down, isolate it, and put a systems fix in so that computer program, that system, that series of functions no longer operates the way it does and potentially puts us at risk. And by us, I mean our patients. I'm often asked what characteristics make a good quality management professional, be they anywhere in the leadership, and have an attuned focus on quality. And my response is always dogged persistence and abundant curiosity. And you need both of those things in spades when you're delving into computer issues, because you will run from team to team to team because oftentimes they aren't well understood. I'll get off my soapbox about computers and we'll fall into a black hole. So once we've gone through and we've detected our events, we've reported them, we've done the initial investigation and the remediation. Now that data is off into our system, and we really, for the sake of our systems, we need to avoid the data black hole. Way too many organizations, way too many systems are focused on putting the data into the system and not pulling it out, and not using the data collection and analysis to drive systemic improvements. How you classify data directly leads to how it can be used. Oftentimes, if you're building a system anew, it's good to think about the reports and how you'll use the system afterwards. We classify our events using the path of workflow at our organization. Our current event reporting system allows for modification of categories to capture new workflows. Some of those workflows, when you think about it, follow the patient experience, from the reagents and supplies that we gather, to the order, to the collection process, to the identification and labeling of the identification of that patient, to the labeling, to the accessioning and the handling, and ultimately the processing of that sample and the analysis of that sample. And then there's the testing and the results. By far, what we have found in our experience is most of the events or the nonconformances happen in that pre-analytic workspace. And so when you look at our primary, we have 3 tiers of categories for our event management classification. When you look at our primary classifications, you will see that they have, around collection, there are numerous secondary and even more tertiary categories. The benefit is we have the ability to modify those categories so we can focus our data collection efforts and get meaningful data out of the black hole. We have common names for different laboratory operations. So when we're looking across the laboratory or the division, or at the very high level, the department, over 70 plus laboratories, we have a standard of what it is to have a collection delayed or deferred, the standard about what it means to have a lost or misplaced sample, things of that nature. We speak the same language. We put in, and we've trained our staff on how to enter events and how to categorize those reports so we can agree on a standard way of doing it. So when you generate reports, you can more easily pinpoint the issue. The bottom line is, the easier the data is to work with, the more you will actually do with it. If your nonconformance reporting system is electronic and it doesn't have a robust report generating function or data analytics, don't despair. There are business intelligence and analytics software systems out there that you can leverage to basically partner with your system to dissect and understand your data. Internally, we use a Tableau analytics platform to interface with our system data so we can better understand what the people submitting the events are telling us through the reporting tools. This data analytics system that we employ has the ability to break down our event entries into any category, and numerous ways to slice and dice the event categories. We can look at the total number of events, the total number of events by certain categories. We can track the number of unique personnel entering events. So we can track, out of a group of 5,000 people, or 1,000 people submitting events. We can get the primary event categories. We have event reports that are looking at our events open too long. So we can look at events that have been open 15 days, 30 days, 45 days, knowing that between detection, discovery, and investigation and reporting, the longer that time span lap is, the more information, or the more information you lose, because your memory fades and our reporting tools don't capture it as well. There's a lot that you can do with your data, but I caution you, don't have a data repository only. Use the data to drive process improvements across your organization. If your reporting system is paper-based, I really can't comment on that directly, other than by saying that people have created physical files for millennia. I am of a certain age where I fondly recall going to the card catalog at the library and feeling that bit of triumph when I pulled that out there. There are ways to standardize paper-based reporting systems so you can still drive process improvements. It just takes a different format and look than the electronics. So beyond the categories and looking at our data across the systems, we also capture patient information. So we can look at different tests that are associated with different categories, and we can see if we have problems, say a collection issue with a specific test. Another way we focus on the data at our organization is to create a risk, frequency, and impact matrix. See here on the left-hand side, we have the frequency rating from rare to almost certain, and on the top, we have the risk impact from insignificant all the way to significant. And this yields a green, yellow, red matrix. So we can identify events that have significant impact to our operations and our patients, and we can focus our root cause analysis efforts accordingly. In the risk frequency, we have start with rare events that occur rarely or almost never occurs. If you are a numbers or a quantitative organization, this would be something that you would define as like less than 1 per 10,000 opportunities. And then you progress down to unlikely, may occur every 3 months, to possible, something that's going to occur potentially once a week. Those moderate occurrences, or those possible occurrences, are more like a 1 in 1,000 if you're looking at a production environment. And then when you get all the way down to those risk frequencies where it's almost certain, that's going to happen almost every time, or more than, say, 1 per 100 opportunities. Looking across the top, insignificant to significant, we have a definition in our organization that, based on risk, where insignificance is really based on the failure mode and effect analysis severity rating scale. So we have no harm or injury or interventions, no adverse outcomes, but potential risk is evident in that insignificant category. And then we go all the way to our significant category, where failures would cause patient or donor death and widespread system breakdown. And with these color categorizations, we have the green being where we need to monitor that. The yellow is definitely take a hard look at those events. Root cause analysis is recommended, but not mandatory at that level. And then we get into those events that grade out as a significant or greater than 40 in our scale of ranking. And those we require a root cause analysis to be performed. So let's talk about root cause analysis. We would be doing ourselves a disservice if we didn't cover root cause analysis, but today's discussion is not meant to be a full in-depth analysis of root cause analysis and everything that can be done when you perform one of these. But your root cause analysis, or RCAs, we'll talk about this going forward, is really where you are digging into the event and you're getting to the why. We've talked about the who, what, where, when, and how in previous slides. And this is really the why of the event and digging down. And one of the mechanisms that you can use for your root cause analysis is the 5 whys. Other ways that you can dig into a root cause analysis are using a DMAIC model where you define, measure, analyze, improve, and then control. There's many ways of conducting a root cause analysis. But anytime we do a root cause analysis at our organization, we really keep the 5 safe behaviors that we developed for the Mayo Clinic at the heart of our analysis. And that's pay attention to detail, communicating clearly, speaking up and responding respectfully to our colleagues, and really handing off effectively and supporting each other. And you can see here, when you look at this slide, those are echoed in the materials we have. We have our culture, we have our empathy, and we have systems thinking that is the base of our RCAs. We set the tone for our root cause analysis from the very beginning. We bring in experts. We support each other as we're going through a root cause analysis. Again, we get back to this culture where we cannot blame individuals. We need to look at systems and systems thinking. We need to have an eye on continuous improvement. Once we set the tone for the root cause analysis, one of the things I often do is bring the role of empathy into the discussion, where you imagine yourself in that situation and really put your ground yourself in that event. One of the other things that you need to think about as you're going through your root cause analysis and you're kind of thinking through that role of empathy is there support that's needed in way of counseling or other things or other services for those people that were involved in that event. Some of our events can be of a more serious nature, where having support systems and mechanisms for the employees involved in them is really beneficial, not only to the employees, but the overall culture and the work environment. Keeping systems thinking always centered at the RCA level is very important. You need to make the systems you work within better. Again, that's the goal of everybody's root cause analysis. But to keep the fact that people are always involved in these systems, but people are often not the root cause of the event. If you are deriving a human error as the root cause of your event, I strongly encourage you to take a step back and again look at the systems that you have in place. One of the things that's often overlooked when doing an RCA is the implementing the corrective action effectively. So you're going to go through your RCA, you'll conduct the root cause analysis, you'll determine it, and you're going to implement your corrective actions. And then once there's corrective actions that are in place, how are you following up on them? What is your effectiveness check? And what is the effectiveness check length of time between implementation and follow-up? And potentially a secondary or a tertiary follow-up of that. Do you have defined successes so you know if your effectiveness check is actually meeting the intended actions that you're trying to implement? So how do you know that your effectiveness check is actually working? Lastly, we'll end on this slide with the majority of our discussion. This slide is simply, we need to talk and have honest discussions about the events that we have in our organizations, and we need to have cultures that support those discussions. We need to be able to talk about the elephants in the room. One of the things that is very hard for leaders is when staff members bring us problems, they're looking for solutions. And in some cases, the solutions that jump to mind immediately are not the appropriate ones. We need to empower ourselves and other leaders in our organization to take a moment to step back, to think about, is the answer to this readily knowable? Does this exist within our workspace as a known solution? Or do we need to take a minute, do the immediate corrective action that we know how to do, and then not stop there, and then go and look and see if we need to find new solutions and perform some experiments to see what's going to work. And that's really the difference between looking at a problem and seeing it as a technical challenge versus an adaptive challenge. In a technical challenge, when you're looking at that, you're going to know what the solutions are. You'll have, a bevy of solutions to choose from. You can go out, you can find that existing knowledge base to solution that event or that problem. And really not a lot of change is needed. You might need to revisit a procedure or revisit a process. That might be good enough for a first cut for your immediate corrective action. But I urge you not to stop there, to look at the adaptive challenges that are in your organization that require discovery and a little bit of experimentation to get it right. It's not going to be really comfortable for individuals at first because they're expecting you to give them a ready, set answer. And this isn't a or conversation where it's either this or that. It's an and conversation. We can have the technical challenges and the technical solutions up front, and we can transition to adaptive challenges where to really solution that root cause, we do the experimentation where we look at the complex solutions that are possible. There's often going to be multiple of them, and we solution from there. This doesn't happen unless you create that safe space where people are bringing you events, you're having open discussions about them, you're really driving to the root cause of the event and to drive meaningful solutions. Lastly, we'll end our discussion here today with some resources. The first resource is the CLSI document on non-conforming event management. This is a fantastic resource that's available. The other two are books and publications that I have found useful through my course of leadership and being a non-conformance event management coordinator. The first one is titled Staying Alive Through the Dangers of Leading. It addresses some very interesting topics on leadership. And the second one is what we just talked about, touched on briefly, and it's the practice of adaptive leadership. It's about looking at problems and challenges and resisting the urge to immediately respond with a conclusion or a ready fix, and to actually look at them deeply to see if we need more systemic changes and our organization needs to adapt and rise to meet the needs of tomorrow. And with that, we'll close our presentation for the day. Thank you very much for your time and attention.